Spine surgery gets a bad name mostly from the surgeons out there who I think are too aggressive. They operate on everything. You have to exhaust the non-operative strategies first and think of spine surgery as the end-stage solution that it is. There are multiple conditions. Everything from disc herniations to fractures to malalignment to curvatures, all leading to combinations of back pain and extremity pain. Whether it's in your neck, then it tends to be upper extremity pain, or if it's in your back, it tends to be lower extremity pain. We take a very good history so we understand what has occurred. We do a good physical examination so we understand if there are neurologic findings and deficits and things that we're concerned about. And then we do the right imaging studies or laboratory work in the interest of getting the right answer. This is all the discovery phase. And I tell my patients there's really 3 silos that I populate for patients. What do you got? Can I fix it? Do you want me to fix it? In my practice, I spend a large amount of time educating my patients about prevention and management of back and leg pain. When we talk about prevention, it's really pretty straightforward. It runs into some simple categories: body habitus management, movement, core strengthening, and elongation. And yoga is kind of the buzzword these days, but the idea is stretching and elongation. Those things will keep patients out of my office. And many patients who just understand and adopt that idea will leave my office and never come back. And that's a good thing. That's not a bad thing for me, right? Because that message gets out there and people understand that that's the right way to do things, and it happens. And the non-operative stuff really works. Leading a lifestyle that is fit and active will prevent many things. And I tell them, I'm selfish. It may be very helpful for a lot of things in your life. I'm just worried about their back and their neck. I tell patients also that the spine world is a large sphere of which I am a small sphere butting up against that and interacting with that. So the world of spine surgery really is pretty small. The way we manage things non-operatively is vast. Everything from chiropractic management to physical therapy to injections and acupuncture. I have a guy who goes to a witch doctor, literally goes to a witch doctor. He swears by it, and I don't poo-poo anything. If it works and that keeps them out of my office, it's absolutely the right thing to do. But then we go back to the need for spine surgery, and spine surgery is indeed one of those things that you want to try to avoid. But I have the skill set to go after it. So you've got a big disc herniation, we do relatively small operations, make relatively small incisions, and literally remove the offending agent, the disc that's pushing up against a structure that it shouldn't be, causing lower extremity pain, and sometimes that'll be a little bit of a back or neck pain producer as well. Oftentimes, if there are instability issues that go along with that, we have to do some instrumentation. So we really have to add, screws and rods, if you will, in the interest of making that right and stable. So sometimes that's necessary as well. And probably in my area of expertise, I probably have the most experience with doing instrumented cases, both cervical, from the front or the back, and lumbar cases also done from the front or the back. And those cases are complex and challenging, back down to relatively mundane and straightforward. When I see those patients, sometimes with the right diagnosis and the right treatment applied, those patients have life-changing experiences where their back pain goes to minimal and their leg pain goes to 0 and life goes on.